Excellency, I would like to thank you most sincerely for the pressure that you mounted on me, the continued support and leadership that you have given to the health sector as one of your key priority agenda. Many times I met Senator Aaron Cheruiyot and he asked me, in 100 days, kila mtu atakuwa na afya. Today I'm proud that we begin this process. I want to thank our governors. Thank you for honoring our invite. You are the custodians for the primary healthcare agenda. I acknowledge and laud your immense collaboration and goodwill as we continue together. Asanteni sana. But please note, we are in this together, let's do it. To the health committees in both houses, your support by running checks and balances at Ministry of Health in delivering UHC cannot be underestimated, especially now as you midwife the new bills into acts of parliament that shall form the governance structure for UHC. As a ministry, I want to thank the partners who have worked with us. I want to acknowledge CIF, to acknowledge World Bank, to acknowledge CDC, UNICEF, AMREF, PATH, WHO, USAID, Safaricom, and all the development partners for the immense support. Your Excellency, I have two very hard-working principal secretaries. I truly want to acknowledge them today for the work they have done. PS Mary Mudhoni, PS Harry Kimtai, asanteni sana. Your Excellency, allow me to single out Dr. Maureen Kimani and Dr. Salim Hussein, who have been globally recognized for their efforts in community health. In Dr. Salim's word, Your Excellency, today feels like his wedding day. Asante sana, Your Excellency. And lastly, thank you to my chief advisor, my technical advisor, the Director General, Dr. Amoth, and the entire team of Ministry of Health who are looking at us across our headquarters. Asanteni sana, team. Your Excellency, now I would like to recognize our cherished women and mothers across the country, who by default are the first doctors and nurses and clinicians when a family member falls sick. I honor their involvement in the day-to-day attempt to provide healthcare at home. This is a momentous occasion as we live up to the promise in the Kenya Kwanza plan. The flagging off of our community health promoters kit is the actualization of a cherished vision, a vision that resonates with the ideals of universal health coverage and community well-being. We will only achieve UHC through strengthening primary health care, AFYA Mashinani, and empowering community health services, which we rightly call AFYA Nyumbani. As a ministry, we aim to promote health and prevent diseases rather than fighting them, which will in turn address the increasing healthcare costs. The shift from curative to preventive and promotive care is not only a smart investment, but also a guarantee massive healthcare improvements across the 47 counties. Many countries around the world have recognized the significance of strong primary healthcare systems. Countries like Mexico, Brazil, Bangladesh, Thailand, and Korea have made remarkable progress in expanding access to healthcare through community health workers. They serve as examples, Your Excellency, that we model and align with our AFYA Nyumbani initiative. And I thank you, Your Excellency, for the opportunity to be at Harvard 2 weeks ago to meet with the ministers of these countries. As a ministry, our mission is to ensure we build a healthier, more resilient Kenya. This commitment rings true in Kajiado as it does in Kacheliba. This commitment is true in Homa Bay as it is in Elgeyo Marakwet and in Nyeri County. These kits today, Your Excellency, will go to alleviate the health burdens in Trans Nzoia County as they will in Tana River County, to improve wellness in Laikipia, Loichogio, and Lamu. We hope that they will help Kenyans to receive early diagnostic and referral care from the comfort of their homes and villages nationwide. Your Excellency, community health services stems from the inherent right of every Kenyan to access quality and affordable health care. It is a demonstration of active pursuit of a healthier nation. With an estimated 10 million households, our strategy for outreach is to leave no one behind. To ensure that we understand this, allow me, Your Excellency, to help all those who are slow learners like myself and have difficulty with numbers and figures, except when they are dealing with money, Your Excellency. Most people, when there is a 10-cent reduction in their M-Pesa, and the CEO of Safaricom is here, will tell you, they will know Safaricom imekata shilingi zangu 10. But in this case, Your Excellency, 10 community health promoters, each is tasked with 100 households. That means 1,000 households, Your Excellency, form one community health unit, which we call the CHU. And this CHU, Your Excellency, is headed by a community health assistant that we refer to as the chair. This will establish approximately 10,000 community health units in the country. These units are the bigger part of a larger primary care network, PCN. This means that each unit is linked to a specific level 2 health facility, commonly known as dispensary, and a level 3, commonly known as a health center. These facilities are mapped to level 4 facilities, such as sub-county or county hospitals, and we are creating a hub and spoke model where the level 4 facilities serve as the central point.
Kwanza kabisa kama bunge la Seneti, Your Excellency, nataka kusema tuko tayari kupitisha mswada ambazo siko katika bunge la Seneti. Tuko na mswada ya Facilities Improvement Fund Bill ambaye itaipa nafasi hospitali zetu kwa zile fedha ambazo zinaenda kwa hospitali siweze kutumika kwa hospitali. Na mimi nataka kusema Your Excellency, kwa hiyo mswada itatusaidia sana. Hata wale wadhamini watatuma fedha kwa minajili ya afya, itatumika kwa afya pekee. Pesa za hospitali sasa haziwezi tumika kwa mambo ya barabara ama mambo ya stima, itakuwa pesa za kutumika katika hospitali. Ya pili, tuko na Primary Healthcare Bill ambayo pia tunashughulikia, na tunajua ndani ya wiki moja tutakuwa tumeweza kupitisha kama bunge la Seneti. Kwa community health promoters wetu, nyinyi ndio watu ambao watabadilisha mambo ya afya katika taifa la Kenya. And Your Excellency, mahali tunarudi ni mahali afya ya Kenya itasonga mbele. Tukiwa watoto katika shule, tulikuwa na kila Wednesday ilikuwa Dental Health Wednesday, ambao wanafunzi walikuwa wanafunzwa bila ya kuchunga afya ya meno, na hii sasa inarudishwa ile prevention, na Waswahili wanasema ni bora kuzuia kuliko kuponya. Kwa hivyo nyinyi kama community health promoters, sisi kama bunge tutahakikisha mswada hiyo imepita, mambo ya yenyu ya stipend itakuwa katika sheria, na kwa hivyo mtakuwa mnapata kwa wakati kupitia serikali kuu na serikali ya county. Your Excellency, bunge la Seneti iko kule Turkana kwa bunge mashinani, na kule Turkana pia tutashughulikia hizi bili mbili. Kufikia Thursday tutakuwa tumepitisha, kwa sababu tumeweka program ya kuhakikisha bili sisi zinapita iwezeshe UAC kufaulu. Ya mwisho, kwa wizara ya afya na wizara na serikali za county, sisi kama bunge tuko tayari kufanya kazi na nyinyi kwa karibu sana, ili kuhakikisha yale ambayo tulijifunza wakati tulijaribu kuimplement UAC na hii kufaulu, tuweze kufaulu sasa. Governors ambao wako safari, Your Excellency, mimi nataka kuambia kama former governor, wako na bahati sana to be a governor in this era where we have a government that believes in devolution, starting from the president and the deputy president himself, to have a national government that sends money to counties on time. I want to tell you, ladies and gentlemen, you are the most fortunate governors we have in this republic today. It is up to you and your teams and us to support you to make sure that for the first time UAC succeeds and succeeds for life in this country. Thank you very much.
Today, Your Excellency, marks a historic occasion in the pursuit for better health and well-being of Kenya's citizens. As you know, county governments greatly value the health workforce, and recognize that this important resource is central to the delivery of quality health services. In this regard, Your Excellency, county governments and the devolution family at large is here to celebrate this launch of our Community Health Promoters Program. Let me take this early opportunity on behalf of the Council of Governors, county governments, and on my own behalf to thank you for making time off your busy schedule to be here with us on this important and momentous occasion. Your Excellency, we applaud you for prioritizing the health agenda, especially strengthening primary health care. This is the heart of universal health coverage. Your presence here underscores the importance of this program and its potential to transform the health landscape in Kenya. The return on investment in community health is well documented, and when implemented, this has a ripple effect to all social pillars of our nation. Your Excellency, the CHPs being launched here today will be a driving force behind healthier communities, and their work will undoubtedly reduce the burden on our healthcare system by preventing diseases, promoting healthier lifestyles, and providing vital support to those in need. As such, county governments remain fully committed to supporting the CHP program through allocating resources that will match national government allocation. As you may already know, most counties already allocate over 30% of their total county budgets to health, despite having 14 devolved functions. Some of these resources support primary health care. Your Excellency, we know that this launch is just the beginning of a long journey, since we must ensure that all CHPs are well trained in various modules, facilitated with kits, motivated and retained. I hereby seek to urge the support of all stakeholders, including our local and international development partners, to prioritize community health as a key contributor to universal health coverage. We need both technical and financial support in actualizing this noble cause.
I want to assure the counties that the government of Kenya, the national government, and me in particular, I support the counties in the delivery of health. They have done a good job, and my responsibility is to support you so that you succeed and Kenya succeeds. We have no intention whatsoever to reverse. I know there are people who have been complaining about health and this and the other. Take it from me. I believe the counties have done a better job in delivering health than before when it was being delivered at the national level. And because you are doing a good job, our responsibility is to support you so that you succeed in the delivery of that health. And this program is one of the initiatives that will support you to make sure you deliver on health, because when you deliver on health, counties succeed and Kenya succeeds, and the people of Kenya succeed. And that is the success we are looking for. Hapa tuko na wabunge wetu na chairman wa kamati ya bunge ya health yuko hapa. Chairman ya kamati ya Senate wa health yuko hapa. Na wabunge wako hapa. Tumekubaliana na wao kwa sababu hii safari inaanza kutoka katika kila household, kila nyumba. Tutaingia katika dispensary, tutaingia katika health center, tutaingia katika sub-county hospital, tutaingia katika county hospital na referral facilities zile zingine, na tumepeleka sheria bunge. Mimi nawauliza wabunge, and I want to thank the partnership of the members of parliament and the members of the Senate. They have been immensely helpful. I request you, members, to work with us to expedite the legislations that we have put in place so that we can make sure that this program is anchored in law and our entire bottom-up delivery of health is anchored in legislation that is going to make sure that it is successful. We have tried this before and it didn't work because we didn't get it right. We have spent the last 8 months with different stakeholders, with different people, and we have now agreed on a formula, and that is why we have taken legislation, 4 pieces of laws to Parliament that have been agreed upon between the national government and the county government so that we can deliver health on a firm legal and legislative footing that will make sure that it doesn't fail again this time round. So tumekubaliana na wabunge wako hapa, mtusaidie kupitisha hiyo sheria ndio hawa wangwana wafanye kazi ambayo sheria ya Kenya inawatambua. Leo tunakutana hapa kuanzisha safari ya kubadilisha vile afya itawafikia Wakenya katika vijiji zetu kila sehemu ya Kenya. Hapa tumekutana kwa sababu kwa muda mrefu tumekuwa tukipanga afya ya kutibu, lakini saa hizi tunapanga afya ya kuzuia magonjwa. Na ndio sababu hiyo tumekutana hapa leo. This moment is a moment of a paradigm shift in the delivery of health in our nation. This program, I am told by the Ministry of Health, has been in their books, has been in their plans for the last 17 years. But I am very proud that today we are actualizing the dream and the aspirations of many Kenyans who have always wanted health delivered at the household level. Today, we are going to launch this program of community health promoters. We are launching a program that will see our community health promoters, number 1, to have kits. Every health promoter in Kenya, the 100,000 of them, each one of them will be equipped by the government of Kenya with a kit that they can use for making sure that they can access every household in Kenya. And we have split every community health promoter with 100 households in every part of the Republic of Kenya. Today, we are starting that journey. Number 2, we are also starting the journey to register every household in Kenya so that we can have the information on the health requirements, on the health condition, on the prevalence of whatever diseases in every part of Kenya, so that our health facilities and health delivery will not be based anymore on guesswork, but it will be based on information collected by our community health promoters from every village and every household in the Republic of Kenya. And number 3,
it gives me great pleasure to join you this afternoon, Your Excellency, as we launch this important community health promoters program. Safaricom welcomes the opportunity extended to partner with the government in supporting community health promoters and the larger AFYA Bora Mashinani. Before I go any further, you may ask what a technology company has to do or be involved in health. We have been involved in health for a very long time, Your Excellency, both at a national and also at a county level, supporting a lot of the counties, especially in supporting to equip hospitals and also support communities on the ground through the foundations. Our support to this program, we are fully aware of the challenges that plague our health system today, from the shortage of critical medical supplies to the need for efficient health financing mechanisms. As a technology company, we understand we need to support with innovative solutions to help address these challenges and issues. We are thus happy today, Your Excellency, to partner with both the national government and the county governments in strengthening the community health services. Our support aligns with the 4 pillars of healthcare, namely health, commodity security, health care financing, health information technology, and critical AFYA bora mashinani, focusing on primary health care networks. As your technology partner, we'll provide connectivity, infrastructure to store the data, our cybersecurity solutions to ensure data integrity and safety, and a call center to support, among other services. Beyond being a technology company partner, we are supporting by contributing close to 100 million through subsidizing the cost of providing the 110,000 smartphones that the ministry will provide to CHPs. Our commitment goes beyond providing connectivity and our smartphones. We are dedicated to digitizing the healthcare sector and are ready to power this transformation, creating a digital healthcare superhighway. We are ready to invest in affordable connectivity and also infrastructure. But this is not just about Safaricom. It is also about building an ecosystem around healthcare. We are committing to partner with the ministry and other stakeholders to create an environment where innovation thrives, where healthcare services are accessible to all, and where our people can lead healthier lives. We continue to invest and create unique opportunities in health and also other critical linked sectors to improve people's quality of life. In closing, Your Excellency, I reiterate my unwavering and Safaricom's support for healthcare sector. We are not just a telecommunication company. We are committed to partner in the journey towards a healthier Kenya. Afya yetu, jukumu letu. Asante sana.
We are going to have the opportunity going into the future of working with the counties. And I want to thank all our county governors. Tuwapigie makofi county governors wetu jameni. That we are going to partner with them to make sure that our community health promoters have a stipend every month. And we are going to co-share a shilling for a shilling with our county governments so that these men and women, the good people who have volunteered their time, energy, and resources to make sure that they visit our homes, we are now going to reward them with a stipend so that they can deliver that service in a manner that is consistent with what we all want for the Republic of Kenya. From next month, when we launch this program, your stipend will come on time. And we will make sure that it is paid digitally. Italipwa bila, naambiwa ya kwamba na adagala ya kwamba saa zingine inachelewa. Sasa mimi nataka niwahakikishia kwamba haitachelewa tena. Tutapanga vizuri. Tumekubaliana county italipa nusu na national.
Na tukawapatia ahadi ya kwamba kutoka wakati tutaingia, najua wote katika manifesto, mimi nileka kwa manifesto yangu na magavana wengine, na manifesto yangu ya afya iliandikwa na hawa wahudumu. Tulikaa na viongozi wenu, tukasema kila mwezi lazima kaempesa katingike, si ni kweli? Na harufu ya kitunguu itambaye kwa nyumba na nyama, ama ni aje? Si mmekuwa mnapata? Sasa rais amesema ile ambayo nimekuwa nawapatia pia yeye ataniongezea. So Your Excellency, we are very happy that from what we've been able to give the community health promoters, because an investment in the CHPs reduces even our budget for health in our hospitals, that we don't need to use that amount in our hospitals at the primary level. Kila mtu atakuwa na bagi yake, iko na thermometer, iko na glucometer, iko na tablet, iko na vitamins, iko na madawa yote. Mkitembea mtaani muweze kuangalia watu wetu. Your Excellency, before you, you might see only 7,480 community health promoters, but they represent more than 750,000 households in Nairobi that they take care of over here. And so, because before last year, before August, when I got into office and when you got into office, Your Excellency, they had been doing this work sacrificially without a shilling. I will ask everybody on this side to stand up and appreciate Kenya's community health promoters who have been doing this on their own. Asanteni sana. Asanteni. Unaona kuonesha kwamba rais wetu na serikali yote tunawatambua, tunawapenda, tunawalombotovu. Si ndio hiyo? Sasa zaidi ya hawa, Your Excellency, pia kulombotovu ni kupenda kwa wale wametoka ushago kidogo. Hiyo ndio Kanairo, karibuni Kanairo. Your Excellency, amongst this we also have part of the Green Army. Sijui kama kuna vijana wa Green Army wako hapa. Green Army hoye. Mko wapi? Wacha nione kwa mikono. Green Army. Your Excellency, you remember as promised, we said we will employ our young people to help us clean the city. We have already hired 2,500 youth who for now are helping us with El Nino preparedness and mitigation. And we said, because they're clearing drainages, they are unclogging areas that were hard to reach, they're also educating wananchi on what they need to do. The reason we've brought them together with the community health promoters is we need them to realize, and we've told them, that they are one family. The work that they're doing is similar, sorting out our communities at the grassroots level.
Mheshimiwa Rais, miaka 60 iliyopita, waanzilishi wetu wa kitaifa walisema kwamba wana changamoto 3 ambazo ni lazima tupambane nazo. Changamoto ya kwanza ni umaskini. Changamoto ya pili ni kupambana na ujinga. Na changamoto ya 3 ni kupambana na ugonjwa. Kwa hivyo tukiwa hapa, hawa wahudumu ambao wako mbele yetu na wengine wakiwa katika sehemu mbalimbali za kitaifa wanaidhimisha kwamba tangu tuanze hiyo safari, hizi changamoto bado zinatusumbua. Changamoto ya kwanza ya umaskini, Mheshimiwa Rais, unapambana nayo na pia umeweka ile hustler fund ambayo ni ya kusaidia mambo ya kiuchumi. Kwa mambo ya elimu, serikali yako imetoa budget ambayo haijawahi kuonekana ya bilioni zaidi ya 630 kupambana na mambo ya ujinga, kuelimisha watu wa Kenya. Na sasa tuko hapa wewe kuzindua nafasi hii, wahudumu wakipata vifaa vya kutumia kusaidia jamii zetu. Hiyo ni heko kubwa kwa hii miaka 60 ambayo tumekuwa huru, na tunataka tuseme kwamba tuzidi kuwa kitu kimoja chini ya Rais wa Jamhuri ya Kenya, tukishirikiana na magavana wote ili taifa letu lipate nafuu. Asanteni sana.
We had a push for universal health coverage where we majorly, and with a lot of emphasis, decided to emphasize on the curative aspect of the disease burden, where we pumped money into 4 counties and nothing came out of it. We are happy today because we've realized that the best way of tackling the problem is from the source, and therefore we are moving to a very critical stage of ensuring that we use our community health promoters, who are the front-line soldiers as the first line of defense when it comes with diseases. These people are going to play a very critical role in the season we are going, the season of El Nino. El Nino usually comes with a lot of diseases. It also comes with an environment that ensures that the diseases spread at an alarming rate. We are launching this at an opportune moment when we are expecting them to upscale what they are doing to make sure that we are going to have an El Nino with a difference now that we have an army to deal with our disease burden at the primary level. We only ask our governors who are dealing with this, my fellow governors, to ensure that we are prepared for the El Nino. And Your Excellency, there was an ask that there was a commitment to have a fund which is going to tackle El Nino, which is being coordinated from the national level. We ask that that fund to be able to find its way even to the counties where the El Nino will be taking place, and we'll be having a boost to be able to help assist these workers to be able to work better. Lastly, on the issue of the stipend, I will not be mentioning the figures here because the custodian of figures behind me. But Your Excellency, the 50-50 model works very well. However, when the gentleman from Nairobi, the CHV #1, stood up to speak, we observed a moment of silence because of the fallen heroes who went because they especially during the COVID, because they usually do a very risky job. And therefore, in that aspect of the stipend, let us incorporate NHIF. And NHIF is usually not paid monthly. It is normally a yearly contribution. And therefore, when we are paying for CHPs, we should be able to pay the NHIF upfront so that we can ensure that our CHPs have a health cover that is comprehensive throughout the year, even as we struggle with the stipend.